class will be on a joint or joints in the body. And the first thing you have to know is, what's the definition of a joint? And the abbreviation is JT right here. It's a space between the bones and or cartilage that may or may not allow movement in that space. And so in your lab book, there's a whole chapter on articulations and body movements is what it's called. And it has a nice picture of a skeleton with all the different kinds of joints on it. And then a typical joint. And then it has pictures of the different kinds of joints, synovial joints. And then lastly in the book, they also have pictures of the types of movement allowed by synovial joints. And so we'll be going through all of these things quickly and some examples of the knee joint and then the shoulder joint. All right, so on the board I have the classification. How do we classify all the joints in the body? Well, there's two ways. We can classify them on their structure. And so what does this mean by structure? The predominant tissue in the joint space, okay? What's in that little space between the two joints? Or we can do it by functional classification. We can say, what is the amount of movement allowed in that joint space? How much movement is occurring, okay? And that's called functional classification. So the two main categories of joints are structural and functional. So we're going to start with the structural ones first, because that means what kind of tissue is in that joint allowing the movement. And so we have fibrous joints, which are first. They're made out of dense reg CT. And where do you find them? In the sutures, okay? In your sutures in the skull, and also in the root of the tooth. It's called a periodontal ligament, is also considered a joint space, right? And so how much movement is allowed by the sutures and the periodontal ligament? Well, not much. And so if we go over here, their functional type of classification is called synarthrotic. Syn means no, and arthrotic means movement, okay? And so no movement is allowed by periodontal ligaments, so your tooth stays anchored and solid, and by the sutures. You don't have any movement in your sutures, otherwise your skull would come apart, right? And so that wouldn't be very protective for the brain. So now, after this, after dense regular CT in that joint space, then we have cartilage pads on the ends of the bones, little cartilage pads, and they're either made out of hyaline or fibrous cartilage CT, right there. And where do you find these? Well, the ribs, the vertebrae, the clavicle, the pubic symphysis. All of those areas have joint spaces that are filled with one of the two types of cartilage. And then how much movement is actually allowed by the ribs, the vertebrae, the clavicle, and pubic symphysis? Well, its name is called amphiarthrotic. Amphiarthrotic means limited, or just a little bit, slight movement, not much, okay? And so just look at where these types of joints occur, and then you know there's not much movement. Your back moves some, and your pubic symphysis moves a little, but not much. And so that's called amphiarthrotic, okay? Amphi is like amphibian. It spends a little bit of time in the water, a little bit of time on the land. And arthrotic means movement. All right, then the last group of joints, and this is the one we have the most of. This last group are called synovial joints, all right? They have to have a cartilage pad in them, usually made out of hyaline cartilage CT, and then it has to have a fluid in that joint space. And that fluid is called synovial fluid, and it's made out of loose CT matrix, which is actually a liquid, and the liquid is made out of water, protein, and fat. So it's almost like a nice baby oil consistency, okay? What kind of pH does it have? 6 to 7. And so we do have synthetic synovial fluid that they can inject into your knee joint in particular to help it moist and to keep the cartilage pad from disintegrating, right, with age. All right, so synovial joints, where do you find these with the liquid in them and the cartilage pad? The hip, the knee, the elbow, the shoulder, the fingers, the toes, the wrist, and the ankles, right? And so they all have a little bit of fluid and some cartilage pads so that they don't rub against each other and then cause arthritis. So how much movement is allowed by all these joints? I'd say a lot. And so the term for freely movable or a lot of movement is called diarthrotic. Di means it can move many different directions, okay? And so diarthrotic, freely movable, many directions, types of joints, okay? And so that's our classification of our two main groups of joints. They're either going to be structural joints or functional joints. All right, so now we're going to move on to what are some of the specific kinds of diarthrotic joints, specific kinds of the freely movable diarthrotic joints. Now we're going to go over the different kinds or types of diarthrotic joints, which there's a picture of all the joints and how they work and explanations in your lab book and in that joint chapter. And so we have up to 6 of them listed up here on the board, and I just gave you quick examples of where you can find these and how we sort of describe these, the movement associated with them. So the first one is called a plane joint. And so plane joints are in your carpals, in your wrist. And so basically flat surfaces move against each other. So the two flat surfaces are going to move to create movements, and so in the wrist area. So those are called plane joints. Second one is a hinge joint. And so a hinge joint, the movement is stopped, has a definite stopping point. So the best examples are your elbow and your knee. So your elbow, you're flexing like this, and then you're extending. And then hyperextension means you're forcing it past the stopping point, and that's really painful. And so your knee will do the same thing. You can hyperextend your knee, and basically that's very painful too. So those are called hinge joints, the elbow and the knee. And then the next one is called a pivot joint. So something has to move around. It rotates over and around another bone. And so the best examples of pivots are the radius and the ulnar, when you pronate your hand, and then when you supinate it, you turn it out. And so radius and ulna work well that way because it rotates around each other. And then C1 and C2 vertebrae, the atlas and the axis, when you turn your head, that does a pivot, right? So, and then the next one, number 4, I've got ball and socket. And so ball and socket, you have to have a condyle on the head of the bone, and then it has to fit into a fossa, the scooped out area. So the best examples of ball and sockets are your shoulder joint and your hip joint, okay? And then the last two, saddle. The saddle is basically with the thumb, where you can click it out and over, and you can feel it move. And so a saddle joint has multiple movements allowed by it. So one bone is sitting on a saddle like other type bone. And so that would be the thumb bone, okay? And then the last one is called condylar. And so we have lots of condylar ones in the body. Their best examples are in your wrists, the carpals, and in your knuckles. And so they flex and extend, or abduct and adduct. So abduct means to move away from the body. Adduct always means to move towards it. And so your fingers can ab and add and flex and extend. So condylar basically has to have a condyle on the end of one bone, and then it's going to move against another surface and produce different types of movement. So that's just a general definition, and we're not going to get into these too much, but there are the 6 basic types of diarthrotic joints, and some of these you've heard more than others, all right? So now we're going to go on to the next part. Now we're going to go over some of the miscellaneous terms found on your joint sheet on the back side. And so I drew a few pictures to maybe help explain these terms for you. Also, pictures of these are in your lab book, so you can look at the knee joint, the hip joint, and then the shoulder joint. And you can see all these terms that I'm going to go over. And so the first one I want to go over is a labrum. Labrum. because you hear people say, oh, they have a torn labrum. What in the heck is a labrum? Well, it occurs in the shoulder and the hip joint, okay? This is where you're gonna have the major surgeries occurring for this. And so what is the labrum? Well, it's just the bone edge of the fossa on the hip joint. Or if you're talking in your shoulder, it would be the glenoid cavity, the edge of the bone of that scooped out area. So the labrum is nothing more than the bony edge of the fossa, the acetabulum, if we're talking hip. And then there's going to be a piece of cartilage that basically protects that edge of the bone. And then there's another piece of cartilage, hyaline cartilage CT, that goes around the condyle of the femur. So you actually have, and then you're going to have a fluid in there, synovial fluid. And so the cartilage rubs against the cartilage, and then that keeps it cushioned and soft, and so it's not going to be touching the bone. Now, if you have a torn labrum, what happens is the cartilage gets torn off the bone. The cartilage gets torn off the bone, and then you're going to have the head, the condyle head of the femur, or the head of the humerus, that's actually going to start rubbing against this hard bone right here, and then this cartilage is going to rub off right here. And then you're in a lot of trouble when you've got bone rubbing against bone. That's going to cause inflammation in the bone, on the heads of the bone, and then that's going to cause a condition known as arthritis. And so that is what a torn labrum is. It means the cartilage is pulled off, the bone is exposed, and then when this cartilage hits that bone, when it moves, then this cartilage is going to get destroyed eventually. But it all starts with this. And so that's a torn labrum. They're referring to the cartilage on the edge of the acetabulum. Okay, there you go. And so now the next term is basically with the patella right here. The patella is embedded in a tendon, the quadriceps tendon, which comes from the quad muscle, femoris muscle. And so here's the patella, and then this tendon turns into a ligament, which will go down and attach on the tibial tuberosity. So that's sort of a unique arrangement for embedding a bone inside a tendon. And remember, all tendons and ligaments are made out of what? Simple squamous and dense reg CT, right? All right, so now the next picture is the term bursa, okay? Bursa are like little pillows. So they're made out of loose CT, and they're fluid sacs. So the loose CT matrix is actually a liquid, and it acts like a little cushioning pillow between the bones and the pieces of cartilage and the tendons and the ligaments. And so where do you have bursa? You have them in the knee joint and the shoulder joint. Another name for the shoulder joint, of course, is rotator cuff, right? And so I tried to make a little picture here. It's terrible, of course, but here's your quadriceps tendon coming down to your patella. Here's the patellar ligament going to the tibia. Okay, great. And then there's two ligaments that make like an X that go from the femur to the tibia. And these are the ones the athletes always rip and tear, the anterior and posterior cruciate ligaments right here. So the anterior one is in the front, the posterior one goes back down behind it, and it makes like an X right in there. And so the anterior one is the one that gets ripped the most in the running backs in football, right? So those are the cruciate ligaments, and in between the ligaments and behind the patella, we have these cute little sacs, loose CT fluid sacs, called bursa. And every bursa has a specific name to it. Do we care about that? No, but I'm just telling you they do. And so those are the bursal sacs, which will cushion the ligaments and the tendons going around in that area of the knee joint. Same thing for the shoulder joint. Now to finish off a few more of these miscellaneous joint terms right here, I drew a knee joint. And the knee joint is also in your chapter in the lab book. And so right here, I've got a femur, a fibula, and a tibia. And so the first thing you want to notice are the two ligaments out here. And these get injured in a lot of athletic sports. And so what are they called? Well, the one that goes from the femur to the fibula is called the fibular collateral ligament, okay? Made out of simple squamous dense reg CT always. So it's going to stabilize the knee on the outside right there. And then on the inside, it's going to be the tibial collateral ligament going from the femur to the tibia, right? And so that's going to give it stability right dead center. All right, so now what holds the femur to the tibia? Well, we have two ligaments that make a cross right here. And they're called the anterior. This would be the anterior one right here. Going right here is the anterior. One coming here. And this one is the posterior in the back. So anterior and posterior cruciate ligament. And so those are the ones that football players really injure quite often. So an ACL injury stands for anterior cruciate ligament. All right, and then what else is unique about the knee joint? Well, we have something called a medial meniscus. And what it is it's a piece of hyaline cartilage, and it's sort of C-shaped right there. And so that shape of the hyaline cartilage is called a meniscus. All right, on this picture, I actually have a humerus, and then I have a radius and an ulna. And there's just a couple miscellaneous terms before we start the muscular system. And so here is a muscle right here, and here's its origin, and they always say a muscle has an insertion site. And so the origin site gives it stability, it's stationary, it doesn't move and nothing. It just anchors the muscle, okay? It's gonna anchor the muscle to the humerus. And then how is the lower arm going to actually move? Well, the tendons right here, the distal tendons are going to actually attach to the radius and ulna. And when you contract this muscle, then those tendons are gonna pull on these two bones and make them move, produce a flexion or extension movement. And so the origin also has some tendons up here, and these are called proximal tendons, and they are just attaching the muscle to the bone. So there's no movement involved at this origin site right here. So these are the distal tendons right here, and these would be proximal tendons that are associated with the origin right there, okay? And so those are the terms, origin and insertion sites, that you should remember when we go into the muscular system. And that's just a nice way to draw that real quick like, and there's a picture, of course, in the book. All right, so now the last thing we're gonna cover is what's a joint, a typical joint, how's it designed and made? What tissues make up a typical joint? And so this is a joint that would be a synovial joint. And so it's called a diarthritic joint. And so here are the layers of tissue. And so we have simple squamous, of course, going from a bone to a bone surface. So simple squamous is going to come off this bone, come around, and attach to this bone. So that's the first layer. Number 2 layer is dense reg CT coming underneath there, right here. And so dense reg CT makes a ligament, right? So that's for stability out there. So really, these 2 layers are the periosteum. Remember the periosteum that covers every bone right here? So it's just gonna come off and it's gonna go around the space. It's gonna go around the space and attach to another bone on both sides. So layers number 1 and 2 equals periosteum. Then we have a layer of loose CT sacs called bursa, okay? And so they're fluid-filled sacs with loose CT matrix, and they're for cushioning in the joint area right here. The tissues cushion the different layers. And so after that, then we have a layer of dense irregular CT, number 4, right here on both sides, dense irreg. And then on the very inside, right next to the joint space or the joint cavity right here, we have a layer of loose CT that's called the synovial membrane. And that synovial membrane is going to make a liquid that comes out into the joint cavity, and it's for cushioning right here, cushioning, and it will flow over the cartilage on the ends of the bones, the articulating cartilage pads right there. And so that is a synovial joint. And so this loose ET is synovial membrane. And so the synovial membrane produces this liquid, the synovial fluid, and it has a pH of 6 to 7. What's it made out of? Water, protein, and fats, lipids. And so number 4 and 5, the dense irregular plus the layer of loose ET makes the joint capsule. So that's called joint capsule, and the outside that's going to wrap it and attach it to the bone, that's going to be basically called the periosteum. So that's the general anatomy of a very movable joint called diarthrotic or a synovial joint.